I'm Alex Larson, dietitian, Ironman finisher, and host of Endurance Eats, the podcast where we break down the science of endurance nutrition and turn it into clear, practical nutrition advice to revolutionize how you think about fueling your body. So grab a seat, or keep moving if you're out training, and let's get started. Welcome back to the bonus series of the Endurance Eats podcast. These are the mid-season fueling episodes. They're short, sweet, packed with actionable info, and while I'm prepping for the next season, which I cannot wait, it's going to be so good, I'm answering some frequently asked questions from my incredible endurance athlete community. Question number 1. Due to surgery, I can't train for 4 to 6 weeks. What should I eat to recover well and not gain weight? When athletes get injured or they're having surgery, I think the number one fear is weight gain, losing that athlete physique. I get it. As an athlete myself, I do enjoy feeling and looking fit and strong. And when you all of a sudden stop training, you don't want to lose that. There are 2 things that I would prioritize during this time. One is going to be your nutrition. I'm going to talk about that a little bit more, but the second one here is really important as well, and that's your mental health. For many of us, exercise is our stress reliever. For some, it's the only stress reliever, which is not good. We need to have options for things that can keep us mentally healthy. So use this time when you're injured or recuperating to take that mental break from training and do other things that you enjoy that are stress relieving. Reading a good book, meditation or some light yoga if you're able, catching up on some sleep, get a massage, socialize with friends, just sit out in nature. This will very much help you come back to training mentally healthy. So let's talk about what you can do though with your nutrition so that you can bounce back faster and get back into the swing of things. Number 1 is I'd prioritize protein, lean protein specifically. With most injuries, especially with surgery, the protein is needed for tissue repair. This can also help maintain your muscle during this time that you're not training. The recommendations for protein for endurance athletes is 1.5 to 2 grams of protein per kilogram of body weight. If you can swing it, I had to do the upper end of that when injured or recovering from a surgery. You might find that you're not quite have much of an appetite, so a protein powder supplement would be probably a good idea if you're struggling to get enough protein. And you don't need to slash calories here. When healing, our body does have some higher energy needs. I would really listen to your hunger cues. Your appetite may naturally just decrease a bit with less activity going on. And your carbs are naturally going to be reduced anyways because you're not going to be fueling specifically around workouts. I would really focus on some fiber-rich carbs like whole grains, beans, legumes, fruits, vegetables. This will also help keep you feeling more full and satisfied. If you're going to PT, I know that physical therapy can be quite intense, so you may want to fuel with some carbs before going into those PT sessions. Look for anti-inflammatory foods as well throughout your day. Fruits, vegetables, those omega-3 fats from like salmon, tuna, chia seeds, flaxseed. Vitamin C can also help support tissue healing. So looking at like citrus fruits, tomatoes, bell peppers. Zinc can support immune health. So you can find that in beef and chickpeas. And I'd also really stay hydrated. So watch out for the sneaky calories though from liquids. I would consider reducing, if not eliminating, your alcohol intake during this time. It's not going to help your healing. And those sugary drinks often are just going to be the extra calories that you don't really get any benefit from as well. Then there's supplements. I would first talk with your primary care provider first, but collagen would be one that you could look at. The research is pretty promising for supporting soft tissue repair and strengthening. Ideally, you would take collagen about 40 to 60 minutes before doing some light activity because our joints and ligaments and tendons don't get a lot of blood flow usually, and so it takes about the 40 to 60 minute time frame for collagen to enter our bloodstream after being consumed. So when you do that light activity movement, that's where we get the most blood flow into those ligaments and tendons and joints. And we want to get that collagen in there. to be used for what we want it to be used for. And collagen is a protein. It's not a complete protein, but it does contribute to your protein intake as well. There's also L-glutamine. That is an amino acid. It's a non-essential amino acid, but there's conditional situations where it would be essential. And that would be in more like surgical, trauma, injury situations where you would want to consume some L-glutamine. There's actually a number of benefits for surgical patients. Studies suggest that it can decrease the incidence of post-operative infections. It can play a role in nitrogen metabolism and balance, which is important for tissue repair, and it can contribute to improving wound healing. So those would be my considerations. And if you are injured or if you are having a surgery of some sort, sending all of the healthy healing vibes your way, my friend. Question number 2. If the body only stores enough carbs for 1 to 2 hours of heavy exercise, why is it important to do a massive carb load? So yes, you are correct. Fully loaded glycogen stores provide energy for about 90 to 120 minutes of exercise before you start to fatigue. If you don't carb load, you will likely fatigue even sooner. So for endurance events, especially the long ultra distances, if you don't carb load effectively, there typically isn't enough nutrition mid-race to save performance. And this is why we need you to do a pre-race carb load, a proper one. And the longer the race, the longer the carb load. Sometimes they need to be 2-3 days long. And then we also need to combine that with adequate intra-race fueling. And that is what supports the best results for athletes in terms of performance. And then I also have noticed with our athletes that when they do a proper carb load, they recover from the race much more effectively and efficiently afterwards as well. They feel a lot better. So there's even benefits beyond performance. It really sets you up well for a great race. So yes, 90 to 120 minutes of exercise doesn't sound like a very long time, but that's why you have to combine it with a really effective intra-race nutrition strategy. All right, so if you have your own questions you'd like answered, feel free to follow me on Instagram. I very often will do an Ask Me Anything right in my Instagram stories. I'll answer questions on there, and then also we'll pull questions and answer them here in the podcast. And if you're wanting more personalized help, please reach out. Feel free to ask me questions, see if you're a good fit for my one-on-one nutrition coaching program. You can head to alexlarsonnutrition.com for more info and the application to that program. All right, happy fueling and happy training, my friend.